Good morning, everyone. Welcome to our August edition of the Madison, Milwaukee Downtown Exchange. I'm Jason Elser, president of Downtown Madison Inc., and I'll be your host for this morning's panel, where we're going to do what we always do with the Madison, Milwaukee Downtown Exchange, work with our two biggest downtowns to create greater collaboration, growth, and investment in both Milwaukee and Madison. We've got an exciting panel here today about downtown quality of life issues in both Madison and Milwaukee. We're going to have presentations from each, and then we're going to have a panel discussion. We've got a really distinguished panel here today to talk about different quality of life issues, in particular the two initiatives, one in each city that we're going to go through. Before we begin with our panel today, though, we want to say a huge thank you to our sponsors. We've got our presenting sponsor, Reinhardt, our supporting sponsor, Bolt, and our other supporting sponsor, Whitley. So thank you very much for joining us today. And we're going to start off when hearing from our sponsors, Joya Wodarczyk, an associate at Reinhardt. Good morning, Joya. How are you?
I'm great. Thanks, Jason. So like Jason said, my name is Joya Wodarczyk, a real estate attorney with Reinhardt Borner Van Duren, which is a full service law firm with multiple offices, including in our great Madison and Milwaukee. And we are proud sponsors of DMI's and Milwaukee Downtown's Madison and Milwaukee Downtown Exchange. As we all kind of continue to evolve with our downtowns, Reinhardt is committed to assisting our clients and communities and sparking collaboration like we're doing today as we continue to grow with our changing landscape. So on behalf of Reinhardt, we really thank you for being here this morning, especially on a Monday, and for continuing the conversations about our downtown. So I'm just going to turn it over here so we can start those conversations.
Well, Joya, I think that blame for it being Monday at 8:04 is on me. The buck stops with me. So I apologize to everyone, but although I'm not going to apologize to those that are on right now because they're on right now. But thank you, Joya, and the team at Reinhardt. Reinhardt has been a champion of the Madison Milwaukee Downtown Exchange event for years, as has the Bolt Company. And we have John Huggett today, Vice President of Central Operations. Good morning, John. How are you?
Good morning, Jason. As I said, my name is John Huggett. Work for the Bolt Company, serving in the role of Vice President and General Manager. We're really focused on building relationships and delivering construction services in the communities we serve. Bolt is a proud sponsor of the Madison Milwaukee Downtown Exchange Series, and really happy to be here today. We are a 135-year-old family managed and employee-owned construction company with 15 offices nationwide. I have the privilege of leading our operations both in Madison and Milwaukee and also in Chicago. As an organization, we really focus on helping our clients meet their business needs by providing innovative solutions in a variety of diverse markets, from healthcare, education, science and technology, automotive, food and beverage, and heavy industrial. We believe it's through solid relationships that we serve our clients and build our communities. On behalf of the Bolt Company, I'd like to thank DMI for the opportunity to sponsor today's event and look forward to the discussion. Thanks.
Thank you, John, and thank you to the team at Bolt, the teams at Reinhardt, and the team at Whitley for all of your support of this event. All right, we're going to jump right into it today and talk about downtown quality of life issues. We're going to focus on some positive quality of life issues and public safety initiatives that are happening in both downtown Madison and Milwaukee right now. These programs are the foundation and they're fundamental to the great momentum that's happening in both downtowns right now. We're going to feature some really innovative work both in Milwaukee and in Madison. We're going to hear from experts at all levels doing many different things here in the community to try to implement these innovative programs. Then we're going to have a discussion about potential other innovative programs that are happening here today. We're going to start with our good friend and president and CEO of Milwaukee Downtown, Beth Weir. Good morning, Beth. How are you?
Good morning, Jason. Thank you so much for having me today. Really happy to share some of our best practices with you.
Absolutely, yeah, and we've got two great projects here. We've got the community intervention team in Milwaukee, and we've got the ISMAS Safety Initiative in Madison. We're going to go over presentations on each so that our viewers can understand really what we're talking about, and then we're going to open up with a panel discussion, and we will have question and answer at the end for our audience. If you do have a question for any of our panelists, please submit those questions in the Q&A function at the bottom of the screen. Now we'll get to as many questions as we can. So again, Q&A function at the bottom of the screen, open for question and answers at the end of today's presentation. Beth, I think you're going to get started with talking about Milwaukee and introduce the team from Milwaukee. You've got quite a team here. I'll say I feel underdressed by a couple of the folks here in uniform and in great suits. I should have worn a tie for today's event, but you know, what can you do? Beth, let's hear what's happening in Milwaukee.
Well, thanks so much again, Jason, and everybody who joined us this morning. Hope you're coming off of a great summer weekend in Madison and in Milwaukee. And I want to extend sincere gratitude and thanks to members of our community intervention team who took the time out of a Monday morning to join us. Eric Collins-Dyke, thank you so much. Eric serves as the Deputy Administrator of Supportive Housing and Homeless Services, Milwaukee County Housing Division. Kent Laverne serves as Chief Deputy in the District Attorney's Office in Milwaukee County, and Robert Thiel is District 1 Captain, recently promoted to Captain. We're so happy that he is now assigned to District 1. So want to extend my sincere thanks and gratitude because of this collaboration. We have been really able to establish and implement some fabulous best practices that wherein we have led with compassion as it relates to addressing quality of life initiatives. So with that, I just want to talk a little bit about how our team began to work together. So in 2014, Milwaukee Downtown, there's an organization that has been around for a couple of decades. It's called the Downtown Security Network, and it is a fabulous team of leaders who work in the securities industry. And I don't mean investment securities, property, building, and personal security companies that represent all of our property owners in downtown Milwaukee. And they convene on a monthly basis. And it has been a really fabulous initiative. And Kent Laverne and I were at one of those meetings, I believe it was in 2014, where people were really getting engaged in dialogue around aggressive panhandling and issues with individuals who were sleeping in parking decks, parking structures, individuals who were making people uncomfortable with aggressive behavior and some public nuisance behavior in the right of way. And what we saw at that time was this bucket that everybody was referring to everybody as homeless. And please bear with me as I walk through this explanation. And what we learned as we began to make space for some dialogue and really better understand what was happening around some of these quality of life initiatives was that not all unsheltered or homeless individuals are panhandlers or are the ones who are engaged in these public nuisance issues. And not all panhandlers are unsheltered or homeless individuals. And so number one, we needed to really, as a community, learn to differentiate between what we had as some bias. We do know, and I'm certain it exists in Madison, I've witnessed it myself. There are individuals who actually make a living off of aggressive panhandling, and some of them do quite well, and they're drawn to our downtowns because of the density there, because of the activations and all of the activities that are happening. And it's just an automatic magnet. So the other initiative that we discovered is because we have so many social service agencies in our downtown area, we do attract a lot of our unsheltered population. And we've come to accept that, and we've come to work with our individuals here. And I think by building rapport and relationships and showing respect at all levels, we have really been able to develop and maintain some great healthy relationships and understand that we do need to provide wraparound services for all of our citizens in the city of Milwaukee. So I just wanted to kind of start with making space to really look at not creating biases around individuals. So next slide. Today we're going to go into with the panelists from Milwaukee how and why our community intervention team was developed, our housing first philosophy, a little bit about our homeless outreach coordinator position and her responsibilities, and then we're going to talk about the effectiveness of that housing first model and how we've seen it come to light in the city of Milwaukee. And then our community partnership unit responsibilities and how we all work together. And then Milwaukee Police Department's role in our community intervention team. So one of the things, and I think all of us see this, is that downtowns must feel safe. And Milwaukee Downtown is in our 26th year of operation. And we have repetitively seen through our market research, our surveys, and our touch points and conversations with our community that really downtown, the most important thing, and it's not only downtowns, it's when we travel, it's when we are visiting other communities, people have to feel safe. They've got to feel safe, and feelings of safety repeatedly rise to the top as the number one important item as it relates to people visiting, living, working, or playing in our downtown and in other communities. So police and fire protection and responsiveness, prompt responsiveness really fell second. And then of course, cleanliness. So we just recently engaged in the update of our downtown area plan with the Department of City Development. And of course, feedback is always critical as we are moving forward with not only a land use plan, but a plan that will guide us in our goals, objectives, and strategies moving forward. So Milwaukee Common Council just adopted that plan after a 2-year public process. And what we saw repeatedly through this process again is that feelings of safety were really critical in our community, along with a variety of other initiatives. So please, if you're interested in that plan, we'd love for you to go to connectingmke.com and see the plan in its entirety. I'm focusing today on quality of life initiatives because that's what this webinar is for. So once we were at the end of that, of the downtown area plan, we moved into Milwaukee Downtown Bid 21's strategic planning process. And we reached out to our stakeholders. And what we saw repeatedly was in that prior slide, the number one goal and objective for everybody was, again, the addressing equities and the feelings of safety, whether people live, worked, played, or visited downtown Milwaukee. I just wanted to share this particular quote from a downtown CEO. As you know, Milwaukee is punching above its weight. We've been so fortunate with the investment from so many of our large employers and new employers coming into downtown Milwaukee. And with that, investing in our property tax base, investing in attracting a workforce here, and investing in community and civic initiatives. So this is just one quote from one of our CEOs who is really focused on downtown Milwaukee, is a huge supporter, but reminds us that if downtown is perceived to be unsafe, the prestige of a downtown address is swiftly negated, and employers are especially sensitive to perception issues as they relate to that employee recruitment. And we all have to remember the war for talent is still going on. So I think that's just a really good touch point for all of us as we're looking at where we're focusing our resources. So I referenced earlier a meeting that Kent Laverne and I attended at the Downtown Security Network. And it was at that point in time that we said, you know what? We need to stop the Groundhog Day cycle. We need to better understand what it is that we can do to interrupt the cycle of homelessness and to also look in a more healthy way of how we take care of all of our citizens and how we build a better collaborative partnership. And I was so pleased that when we reached out to Milwaukee County Housing Division, the Behavioral Health Division, the Police Department, the District Attorney's Office, the City Attorney's Office, the City of Milwaukee, the State of Wisconsin, Visit Milwaukee, Marquette University, and other near downtown neighborhoods, everybody was on board. And we got together, and believe it or not, in those first year and a half, and I know Eric Kallenstein can remember this, we literally met every single week for 18 months on this community intervention team. And we looked at solutions for addressing homelessness and other public nuisance behaviors that were continually identified. And then we looked at best practices nationwide. One of those best practices nationwide that was brought to our attention by Jim Mathey of Milwaukee County Housing was an initiative referred to as Housing First. You can go to the next slide, Jason. This initiative of Housing First was really first brought to our attention by a gentleman by the name of Dr. Sam Sambaris. So he really fathered this Housing First model. And what Housing First is, it's a policy that offers unconditional, permanent housing as quickly as possible and as available to our unsheltered individuals and other supportive services afterwards. So attaching housing with no conditions, providing people with a safe space to call home, providing our individuals with those support services that help address quality of life initiatives. So we first had the announcement of this Housing First model at a symposium that earlier group I referenced collaborated and put on in the community. And it was a little bit of a lukewarm reception because it was not tried here in the city of Milwaukee. Eric's going to talk a little bit about that, but it's proven to be enormously successful. And at that point in time, in 2015, together, this group, this larger group, identified and created and implemented some other initiatives. We put into place the creation of a downtown homeless outreach coordinator. We developed a downtown community prosecutor, which is now called our community partnership unit. And there was a new homeless resource center that was open. And what I want to say again is that this was an initiative that was developed collaboratively and otherwise would not have worked. So an extraordinarily successful initiative. We moved into developing these positions. I wouldn't say on a hope and a prayer, but almost. And then we moved into an initiative to help raise funds to fund these positions. And we developed, you can go to the next slide, Jason, a program called Key to Change. And it was a local campaign that we launched in September of 2017. We put these branded parking meters out into the right of way. And we collected loose change on the streets, but we also developed a campaign that helped us to raise funds to help fund these positions, because these positions were not only within Bid 21's boundaries, they essentially followed the boundaries of Police District number 1, and then of course overlapped into other areas in that greater downtown area. So we wanted to be able to reach out to all of our partners so we could all chip in and help support these initiatives. I do also want to say it was under the leadership of County Executive Chris Abley that really supported, and his team advocated for the Housing First model. And but for that model, none of this would be successful. So we still accept online donations for Key to Change. And people who go to the site who want to participate in supporting this initiative can decide if they want to fund the Downtown Homeless Outreach Coordinator. They can also help fund rental application fees and security deposits, or they can help to fund move-in kits that help get our residents established as they're moving into their apartments for the first time with some of those essential needs. So with that now, I'm going to toss it over to Eric Collins-Dyke, who's going to talk a little bit about, well, not a little, because I will tell you, Beth Lappin and Eric and his team have enhanced the quality of life for all of our citizens in downtown Milwaukee. And I'm going to just pass it over to Eric now.
Thanks so much, Beth. Really appreciate all of your support over the years. I will say, you know, having your downtown business district and community stakeholders within that jurisdiction understand the complexities of homelessness and the issues that go along with is so important in this partnership. And so I just wanted to name that because we've been very lucky here in Milwaukee to have wonderful partners outside of our system that has helped immensely. You know, Beth touched on this a little bit. So, you know, the first few years of the community intervention team, we sort of pieced together some of our interventions among the folks on the group. And we slowly started to realize that it would be incredibly helpful to have an individual or a small team that was strictly dedicated to the downtown area from a homeless outreach standpoint, not only respond to calls from police, business owners, and constituents, but also to intervene in real time. We realized over the years that a lot of the issues were around folks in that space who wanted to help, who wanted to get an individual connected to care, but they didn't necessarily have access or quick access. And so they sort of saw the system and how it stagnates, and there was some frustration. So, you know, this homeless outreach coordinator that was established in 2019 has really helped in a number of ways on our end, most importantly for those we serve on the street and getting them indoors, but also that Beth and Captain Thiel and Kent will tell you it helped in other ways alleviate some burdens on other systems. You know, there's a lot of folks on the street that we engage with who are dealing with high levels of acuity, both on the mental health and medical side, often co-occurring with aorta issues as well. And so there are crisis situations on a daily basis. So yes, we talk about housing first. We talk about our overarching North Star as permanent housing. There's also very tactile engagement on a day-to-day basis of people who are just really struggling. And so being able to have this coordinator full-time Monday through Friday has allowed us to respond to those in real time, more so than in the past. Our goal and Beth's goal when she started, Beth Lappin, in 2019 was to connect to individuals to indoor placements as quickly as possible. We call it housing focused outreach. We do a lot of the traditional things that street outreach teams do in terms of supplies, engagement, building rapport, assessments, but we always have that housing piece in the mix from the first time we connect with an individual. I would say too, working on the community intervention team and being able to have that ongoing communication with community prosecution unit, with MPD, has actually allowed for less enforcement around homelessness, which was, Beth knows, when we first met years ago, was my goal, is to how to tackle this in a way that we could be able to provide services, but also understanding what the business community and others have had to deal with because of lack of services. So I would say that communication sort of opened up a whole new world for us. We really looked at, when we started trying to drill down on some data and what things look like. One thing I like to point out, that has really resonated across our community and across downtown is, after we started implementing housing first, specifically in the downtown area, we saw a massive decrease in municipal citations related to homelessness. So loitering, public drinking, trespassing. And as some folks know, you can get a trespassing ticket for sleeping in a doorway of a private property, which was happening a lot for clients. And we looked at the first 85 residents of folks that we moved in the first 12 months they were in housing compared to the 12 months before that. And the 12 months before that, the majority of the folks were on the street in the downtown area. 98% of them had multiple municipal citations. 12 months after that, it was only 9%. So we saw that immediate effect. And I think that really helped us and helped Beth and her group sort of push on the fundraising side to tell folks, hey, this is working, slowly but surely. So you can go to the next slide, Jason. So we've been incredibly lucky. It's not just the county, it's the city of Milwaukee, who was our lead agency on the COC, a number of wonderful nonprofit partners. And honestly, too, the community intervention team, they've helped us on specific cases with housing over the years and been incredibly creative. Since 2015, when we instituted Housing First, over 2,400 individuals have been housed. We've cut the homeless population down as of 2021 between 45 and 50% between what it was. Between 2010 and 2015, it always stayed around that 1,550 number. And we instituted Housing First, like many communities did before us, because we saw individuals on the street for 5, 10, 15 years, just sort of stagnating in place because they've tried all the other housing programs that were more focused on requirements to access housing. So this really opened the door, no pun intended, for folks to move in quickly. The 96% retention rate is something we're really proud of. And I know a lot of Housing First programs across the country have good retention rates as well. That's contributed to, in a lot of ways, just to folks having a place to live, but also the wraparound services that are in place. On our end, we fund our wraparound services for our Housing First program. It's a little over $700,000 of tax levy that the county executive committed to back in the day. And that's been immensely helpful. And then Beth Lappin, there's not enough time in this presentation to give enough kudos to the work that she's done. It has nothing to do with me. It's sort of just innate in who she is and the wonderful work that she's done. And then also collaborating with Brian, the public service ambassador. That's been a wonderful partnership. Brian is able to leverage what he does on the PSA side and what Beth does on the homeless outreach side, oftentimes to effectively intervene in crisis situations. That's been a great collaboration as well. Go to the next slide, Jason. So with that, because of the housing focused outreach, because of how, double down we were in putting resources into that space, in the outreach space, and really because we wanted to move people off the street as quickly as possible. We wanted to make their homeless situation as short and brief as possible. In 2021, 2022, we did hit the lowest unsheltered number per capita in the United States, something we're very proud of. We've certainly seen a bit of an uptick, post-COVID, as some of those resources that we had during the pandemic went away. But I think what we lean on and what we want to continue to talk about in spaces like this is the model that we put together for those couple of years, coupled with the federal resources that, in my opinion, should be every year, not just during the pandemic. You can do really amazing things and get people the help they need and get them indoors. And we couldn't have done it without the downtown bid and the community intervention team. So can't say enough about this partnership, and we're incredibly lucky to have this in our community. And I will say too, we know it's not easy fundraising to have other funds funding a social service outside of our system or outside Medicaid or outside HUD. And so I think, Milwaukee can be sort of a national model around this, and that's due to the leadership of Beth and Kevin Thiel and Kent, and we're just grateful to be a part of it. Thanks.
Okay, I'd like to talk a little bit about our role in this. First of all, I want to echo what Beth and Eric have had to say. We've had a tremendous team put together on this from the moment Beth and I were at that downtown security meeting back in 2014. And she said that partners like Eric's team and the police department and others have been just incredibly responsive to this idea of problem solving and what can we do around this population that everyone's concerned about. And we want to make sure not only that they're taken care of, but if they're doing something that's harmful to other people, we want to make sure that the right level of accountability is applied as well. So one of the things we were seeing at the time we were engaging in this discussion around homelessness is we were charting separately the usage of our behavioral health emergency crisis center with people who were getting arrested, mostly for municipal offenses. And we were seeing a significant overlap, probably not surprising, of people who were cycling between the county jail for low-level municipal violations like loitering and vagrancy and other types of just low-level disorderly conduct charges, and being out of the mental health complex as well. And so again, from the standpoint of what could we do with a population that was much more likely themselves to be harmed themselves or hurt themselves as opposed to being harmful to others, and at the same time consuming a great deal of our medical resources. And this was the same group of people essentially that we were identifying downtown who were in need of permanent housing. And so Eric and his team really have identified many of those people and have put them in a much more stable place than they were before. Certainly, our community prosecutor has been a practice we've had in every police district in Milwaukee for now going on 20 years. And we've found them to be very successful. The objective of that community prosecutor is to be a problem solver. So we often appoint someone to that position who's got a lot of experience, who knows how to work with the police department, who's an effective communicator with neighborhoods and with community groups and all other constituencies that are unique to each one of the police districts. And our downtown was no different than that. We appointed a rock star of an assistant DA. Her name is Kelly Hedge, and she was perfect for this position because she could understand the needs and the concerns of the business community, and she was very effective at understanding those and communicating with other partners about how we could address people's needs when we were in contact with them. She was going out with Eric's team many times. She and Beth were often side by side in the downtown streets, talking to people and trying to figure out what we could do along with our police department to determine what was the best, safest approach for somebody that we were encountering. And on top of it, Kelly was not only incredibly smart, but she's got just a heart of gold. So she was always looking for the right solution that was doing right by the person and the community as a whole. Occasionally, there would be people that would be individuals who were engaging in harmful behavior to others or to property downtown. And of course, we would take a more traditional approach with that individual. But many cases, by and large, we were encountering people who were much more likely to be victimized in a crime than to be a perpetrator of a crime. And so it's having that wisdom to separate the two and knowing exactly how to apply the right level of response to that individual. And so we've continued to monitor the people that we encounter. Unfortunately, Kelly is no longer in our office, but we've got a great prosecutor, Dax Odom, now who has picked that up downtown and very experienced with the same idea that we're identifying each individual, identifying what their needs are, identifying what their behavior might be, and trying to put them in the right place that enhances stability for everyone. Next slide, please. So an example of this was an emerging encampment that was growing under the 794 freeway near 6th and Clybourne in St. Paul. And there are a number of calls for service there. A larger city, essentially tent city, was growing there. And of course, some divergence of opinion about what ought to be done with that. But at the end of the day, it's certainly with the weather approaching that is very difficult for people. Our group doubled down on their efforts to find sustainable, supportive, permanent housing for people, identify the needs that individuals would need with regard to their mental health situations. And in many cases, we were able to take the individuals who were in that area in a fairly unsafe, unhealthy environment and move them into areas and to a more stable place. That again, we think it certainly was safer for the downtown community as well. A lot of what you'll see here is a lot of this is a good example of a part of our downtowns on the west side of our downtown that is very near our Marquette University campus. We have a great relationship with the Marquette Police and the Milwaukee Police, and there's a lot of working together between those two agencies. On our near east side, we of course, the city has boundaries with the University of Wisconsin-Milwaukee, and their police department is also very, very collaborative with regard to our police department downtown. And so there's a lot of information sharing, there's problem solving. It's a mentality of what we can do to solve the problem that doesn't cycle people through our systems over and over again, that doesn't unnecessarily arrest people and detain people who are engaged in very low-level behavior that certainly is annoying and can be frightening, and that frankly will stop if a person is in a much more stable housing situation. And that's sort of one of the benefits of having the prosecutor involved in this, is that the police officer doesn't have to make that decision on their own to perhaps make a diversion decision. That can be done with the blessing of the prosecutor after consulting with our partners to determine that we actually have a safer alternative for a person and for the community if we can get them into the housing that's available to them. So we were very successful in the area underneath that overpass and in placing people in safer, more stable places that also certainly enhance the overall aesthetic of that location and improve the perception again of the safety of downtown. And that area has been through our sewer district and other groups with Eric's department has been redeveloped in a way, and that's the last point here, that it talks about how crime prevention can be enhanced through environmental design. And there are ways that neighborhoods can be developed, that areas within a neighborhood, that public spaces can be developed, not just through lighting, but through other things like how to deal with water runoff and the bricking of different areas or benches or other things that enhance the safety and the perception of a space that at the same time makes it safer, in fact, and makes it a deterrent for people who otherwise might want to use that space for their own purposes. And we have seen this septet is what we call it, this approach applied in neighborhoods throughout the city with a lot of success. And it helps the people who live in that neighborhood or even in the downtown neighborhood feel like they've got control again over that area and that space that they occupy, and that it feels like a much safer space for the entire public to enjoy. So these are examples of what our prosecutors do downtown as community prosecutors, and continue to engage with our community intervention team.
That leads us to the Milwaukee Police Department. We appreciate the connection that we have with the downtown bid and our Housing First and our community prosecutor. It's really have taken some of the burden off of the police department when it comes to some of this nuisance behaviors that we encounter downtown. Specifically, people that are going through mental health crisis. We know that we have a partner in the community that we can rely on. We can relay some information to those individuals. We can also contact our Housing First, usually it was Beth Lapham, to engage these communities. And then also working with the downtown bid, we had Brian Johnson, our PSA, to engage. A lot of times they proactively go out and engage, and we work collaboratively with them to if there's some other issues to be had. Having the community prosecutor in office here has been a significant benefit for our downtown police district, basically having them understand different types of issues that we have, where we have someone that's resistant to change or is possibly have some other type of crisis issues going on, and we repetitively see them. We can contact our community prosecutor and they can take it to the next level. Typically, a lot of these offenses are low level, which we wouldn't necessarily arrest and hold for a long period of time. However, they can get the special attention that they're needed or is needed for these issues. We've also will work with our Housing First partners to go on scene if we start having some major issues. And having these meetings monthly has definitely been beneficial because they're the boots on the ground in these communities, and they can give us some insight on issues that maybe we don't see. Because obviously, having just a badge on prevents some of the connection with this population. It also frees up some of our officers to address other quality of life initiatives like theft and stolen autos that seem to be plaguing the downtown area. And with police in general being short-staffed and having this partnership to include others to partake in the team to really provide additional services and the wraparound services that the police department cannot address has been significantly beneficial.
Excellent. Thank you from the Milwaukee team. And I think we're going to transition now into Madison. We're going to talk about the Isthmus Safety Initiative. We have Melinda Knuth, who is the Violence Prevention Coordinator with our Public Health Madison-Dane County. And we have Central District Police Captain Mike Hansen here to talk about the Isthmus Safety Initiative. But I'm going to start off because I was a part of the program now for years. And this program was started in part because we learned models from our friends in Milwaukee and this multidisciplinary team approach, which we just heard the captain and Kent and Eric and Beth talk about here. It's about bringing all of these teams together. And we were the first ones to be able to really try to use those models and try something here in Madison. So we're going to begin with our friend Melinda Knuth, who's having a video issue just as we're coming up here. Melinda, can you at least, there we go. Now we're in. Melinda, again, is a violence prevention coordinator for Public Health Madison-Dane County, and they are the group that run the Isthmus Safety Initiative. What is the Isthmus Safety Initiative, and why are we doing this here in Madison, Melinda?
The Isthmus Safety Initiative, first of all, thank you very much for that. And thank you to the Milwaukee group. That was very interesting. And it was nice to just sit and listen and hear about what's going on. I said at the outset before we were live that I have a heart for Milwaukee. I completed my undergraduate degree there and started my career as a probation parole agent for like 16 years there. So very familiar with Milwaukee and really excited to hear about the work you're doing there. So thank you for that. I was taking some notes of my own to apply maybe here in Madison. So again, my name is Melinda Knuth, and I'm the Violence Prevention Coordinator at Public Health Madison and Dane County. Having violence prevention in public health is fairly new for Madison and Dane County. In general, getting started in 2021. So we're a much newer program than the Milwaukee group that was just speaking. And I came to this work just in 2022 and only just came to the Isthmus Safety Initiative aspect of the work very recently, after the departure of our main coordinator and grant coordinator for this program. So the Isthmus Safety Initiative was part of the Byrne Criminal Justice Innovation Grant. The Madison Police Department applied for that grant in 2019 due to evidence or data around rising crime in downtown Madison and efforts around that to really think innovatively about how public safety, how we can recreate public safety. So police isn't the first thing that comes to mind, but what are some collaborative efforts, just as you were all speaking about it in regards to Milwaukee, that we could do here in Madison. So it's not just relying on police, but the police did apply for the grant. The grant was then housed in the city community development division. and then managed by public health. So right at the beginning there, you see the collaborative efforts and really intentionally designing the way that we're working with this grant to have police, Madison's Business Improvement District, the city community development division, and public health all at the table to be working on these issues. So the Isthmus Safety Initiative came out of a steering committee and advisory committee that spent a lot of time meeting over the months between 2019 into 2020, obviously impacted by the COVID pandemic during that time. The advisory council brought in community leaders, people from UW, downtown business people, residents, downtown business owners, residents, and elected officials, and really decided to focus the work on gun safety or gun violence and sexual violence in the downtown area. And again, Madison is a different, and it's unique in its downtown design, as we are the capital of the state of Wisconsin. So we have, and when you think of downtown Madison, most often people do think of State Street, but you have the university on one end, you have the Capitol on the other end, and you have a lot of tourism in between. You also have a lot of the same issues that would plague any downtown as far as unhoused or unsheltered people. So it's just very unique, but it's also very kind of a smaller area, especially when in comparison to Milwaukee's downtown and some other downtowns. So the decision was made to focus on gun violence and sexual violence, with specifically focusing on violence prevention and really looking at preventative, innovative preventative efforts. And the four main innovative preventative efforts were the idea of bringing safety ambassadors into the area to just kind of walk around, help guide people in the right direction, keep people moving, help provide resources, provide water, but really like a non-law enforcement based effort. And then also violence intervention or violence interrupters that would work specifically with police too after an incident would happen. We have a focused interruption coalition is a group here we have in Madison that does excellent work, primarily hospital-based, but bringing them into the conversation. And then also working with an excellent partner that we have, the Rape Crisis Center, on some de-escalation training for bars, service industry, bar employees, bartenders, service industry folks, called the Safer Bar Initiative, where we would work closely to provide training. The grant did allow for us to provide and continues to allow for us to provide free training for folks in the service industry so that their staff can just feel well-trained, equipped, and confident in how to address incidents that they might be seeing. And again, looking at that prevention piece, how can you prevent things from escalating to a level of violence? And then the other piece, which was mentioned in the Milwaukee presentation, was CPTED, community, crime prevention through environmental design. And that's when we're looking at, are there areas using the data that we have, areas that they're maybe more prone to crime occurring, they're allowing the environmental design, just the lighting or the other factors in that area, is that kind of creating space for negative things to be occurring. So that was focusing in on some of the parking garages, some of the lighting, the cameras, and really taking a look at that and working with our city partners and our downtown business partners to address some of those environmental designs. And I will turn it back to you, Jason. You asked me one question and I think I went on for a very long time.
No, excellent. Morning, you're brand new to the team, so huge thank you. And one of the initiatives you just talked about with CPTED is to really focus with the data, and we did a lot of heat mapping as to where these crimes are happening. Many of them, post 10 p.m., 3 a.m. in and around the 500, 600, 400 blocks of State Street, and we were able to really tactically use the CPTED to work on areas like the Buckeye Lot, which we were seeing some activities that we did not want to see right there between Gilman and Gorham Street. Madison Police Department has been a staunch proponent of the Isthmus Safety Initiative. In fact, this arose out of their department and a gentleman named Jim Powell, but we've got Captain Mike Hansen as well. Captain Mike Hansen, why is the Isthmus Safety Initiative so important for safety in downtown and for Madison Police Department in general?
Great question, Jason. Thanks for having and thanks for everyone that's joining this. It's important to us because we know we cannot arrest our way out of so many issues that are in the downtown area, from homelessness to some gun violence and sexual assault. We just can't arrest our way out of it. So having community partners in conjunction with public health has been critical for us. And one of the things that we really have been focusing, or the two things are the prevention, the gun prevention, and we've recovered a number of guns last year, and then year to date over 75 in the downtown area. And we've done that because we've been proactive. We've been we've increased our staff, and we've worked with other agencies to help reduce the risk of violence in the downtown area. The other parts of that, you alluded to it with the Buckeye lot. For those in Milwaukee, it's a decent sized parking lot that just had two entrances, and people were coming in and dealing drugs and doing other nefarious activity in the parking lot. But with increased lighting, camera coverage, blocking off one entrance and exit, that really helped reduce some of the activity that we were seeing down there. And then what's unique about downtown is, as Melinda said, we have, government with the Capitol, we have tourism, but then we have 45,000 students from September until May, either during the day enjoying the shopping or at night the bars. And every year we get that turnover of freshmen and sophomores coming in, and our outreach in conjunction with public health is through the Safer Bar program. And along with those students, we also get bartenders and bouncers that are changing every 2-3 years as well. And so the education component of all this is critical just to get the message out there. We get a lot of students and people coming from outside of Madison, whether it's a rural or urban area. They've never experienced Madison before. And so any education that we can provide in advance is critical, just to always take care of themselves, stay in control, partner up, be with people, and then look for vulnerable friends, people that have been overserved or intoxicated. How do we keep those people safe as well? And so that's been an important outreach in the Central District.
One of the things we noticed both in Milwaukee and Madison, and Beth, I would start, answer the questions for all the panelists here, is this multidisciplinary team approach, right? You've got public health, you have UW Wisconsin, you have the neighborhood, you have MP, Madison Police Department, you have the Business Association, you have the Institute of Public Health, Population Health, all working on these issues. I think the first question I'll ask you, Beth, is, what do you contribute? What do you attribute to this collaborative initiative success, right? Why is this working to have all of these different collaborative partners working together?
I think, thanks for the question, Jason. I think it's we share the same goal and objective, right? And that is to create a safe environment for everybody who lives, works, plays, and visits. And I think we've all come to know with our relationship building and understand each of the various entities that are working together. We all have limited resources. And I think what we've discovered is with this collaboration, we have been able to really alleviate some of the pressure, because holistically, as always, the sum is greater than the parts. And we've had some staff changes, but not many. That's been really beneficial for us, is that with turnover comes a new learning curve too. And we've just had the same level of dedication with a lot of the partners at the table for a long period of time. So that continuum that we provide, I think, is really important. The ongoing communication, not that everybody needs to add another meeting, but I think gathering, as Captain Field said, in the same space once a month, you just get that reconnection. And we're able to identify hotspots. Dax Odom, our community partner representative in the district attorney's office, he can give us updates on what's happening with what we call some of our frequent flyers and how he's following those cases. MPD can share with us some of the repeat offenders that they're seeing. And, oftentimes it's individuals with mental health issues or addiction issues that really just need these services, not a citation issued or to be thrown in jail. So it really is an understanding, and if you've not read it, The Speed of Trust, I mean, it's all of us working together to understand. We're not here to point fingers, we're really here to help all of our citizens. And I will say, for individuals who are engaged in criminal behavior, we are lockstep in that this needs to be addressed, and we will support MPD in our prosecution unit as well. So, it's a multi-pronged approach that has, for us, proven to be very effective.
The next question I'll ask is to folks in law enforcement, so to Captain Hansen, Captain Thiel, or Deputy Attorney General Captain Laverne. Why is collaboration so important to create a safe environment in downtown? It's not just about, we can't just arrest our way out of it, but what do we do? And it's different. And why are these models and collaboration so important to create not only an actual safe downtown, but a perceived safe downtown?
I could take a crack at that. One generation of ideas and resources is helpful. Everyone's dealing with limited budgets as we are at the Madison Police Department. And so when we have community partners that have great ideas and more resources, that's helpful. But the other very important thing is some of the people that we're dealing with don't always want to interact with the police. So they see public health out there, safety navigators, or any other resource that's out there that's not the police, that are also building trust and offering resources, I think is enormous, and it frees us to do some other work elsewhere.
Folks in Milwaukee, Captain Thiel or ADA Laverne?
Yeah, as far as, I'll continue with that, it's been really beneficial for us to be able to kind of pass the baton on some of these individuals that have caused us some concern that we know need some type of wraparound services, and just being able to get that information and getting another party involved to assist in that dynamic has been significantly beneficial for our quality of life downtown, for long-term care. Where our solutions are immediate but temporary as soon as they're back out, and it doesn't change the way that they behave in general society. So being able to get that wraparound service and to pass that baton to another team member that might have be more successful in long-term care for them is definitely something that's beneficial for us.
Yeah, I would just quickly add, I think from a perception standpoint, people in a community, especially in our business community, but every neighborhood, want to know that their government agencies and partners are working well together. They want to know that their government's working, and I think these models show that different agencies from different perspectives can work together very, very effectively to problem solve and apply the appropriate level of accountability to a specific problem.
The next question I'll open it up to Eric or to Melinda is, what other additional initiatives are you all working on currently to really improve the quality of life, both in supported housing or in violence prevention in Madison and Milwaukee? There's so many new efforts and ideas. Captain Hansen was talking about those ideas. What new ideas are you all working on as well to create the best quality of life we can in downtown Madison and Milwaukee?
I can jump in first. Great question. Yeah, I think for us in the Milwaukee side, because not only do we cover downtown from the homeless outreach service coordination perspective, but the entire city and county. So we've started to coordinate with the 3 other outreach teams in our community to do geographically focused outreach in sort of all quadrants of the city and county. I'd say 90 to 95% of our services are in the city of Milwaukee, but we do often trickle into some of the suburbs. And what that has helped for us is get into other parts of the community and start to develop some of the relationships that we've established downtown, slowly but surely. But it's also allowed us to be more effective in triaging folks into indoor placements as we break up these quadrants of the community and have certain teams focus on certain areas. It's really helped us to deduplicate some of the things that were happening, which often happens in homeless outreach. And so, yeah, we're excited about it. We think the sort of new coordination will help us as we move forward. Like most communities, we've seen an increase in unsheltered homelessness over the last 6 to 12 months. And so we're hopeful this is a step forward to try to mitigate some of that.
And in regards to Madison, as I mentioned earlier, violence prevention in public health is a newer aspect of public health for Madison-Dane County. And we started that with our roadmap to reduce violence, which was a document created using partnerships, residents, nonprofits, business sectors, community and city partners to help develop and identify what are the primary, the best practices around violence prevention, and really taking a systems approach to that. So we are fairly new. So part of that has been developing the relationships. We have the Madison-Dane County Coalition. So developing the relationships among all of the different stakeholders in Madison and Dane County. We were fortunate that we did have access to some ARPA funds. So we were able to do a couple rounds of grant funding, and that's unusual for us, and it won't be something we'll be able to continue. But using those grant funding, we were able to bring these folks together in this coalition and identify the strategies that would be best lifted up with some funding, and really provide support to some of the smaller organizations and community-based organizations that were doing some creative work here in Madison. Most recent round of funding, one of the groups that's very interesting is when Madison schools came back into session, because we were out of session for quite some time. We were virtual for quite some time. There was some ongoing problems at one of our high schools, at Madison East High Schools, and a group of mothers volunteered to basically stand outside and hand out snacks and build relationships outside of during open lunch period outside of Madison East High School. And we were able now to provide funding to that group so they can become more organized, have funding to support it. It's not mothers in their own pocketbooks and on Facebook trying to find money for just snacks. And they saw a definite decrease in incidents that were happening at East High School because of this interaction and the relationship building that was going. So that's some exciting, just a small example of some of the exciting work that we're able to do, having the violence prevention unit in public health, Madison and Dane County.
Well, Melinda, I think last word you said it best. It's about building relationships, and that's exactly what the Madison Milwaukee Downtown Exchange is about. I want to say a huge thank you to our good friends in Milwaukee Downtown and our supporters of this event, Withley, Bolt Company, and Reinhardt. I also want to say a thank you to our panelists, captains, I don't say that very often, captains, plural, Thiel and Hansen, Assistant District Attorney, Deputy Assistant District Attorney, Kent Laverne, Eric Collins, and Melinda Knuth from Madison and Milwaukee, respectively. Thank you for all joining us. And I want to give the last word to our good friend and leader in this space in Milwaukee's downtown, Beth Weir. Beth, how did you think today went, and what can we take moving forward?
Yeah, I think it went great. And thank you so much again to the panelists and for this collaborative spirit that we have moving forward. There are so many other initiatives I know that we're working with in Madison and Milwaukee. One new initiative that people will be hearing more about is the chief is going to be announcing a Community Connect program that is going to be working with cameras in public spaces. I know you've got a similar initiative going in Madison. I think there are a lot of ways in which we can continue to connect civically, to do our part to care for our citizens and address quality of life initiatives. We're always happy to be partners and to help and to share. And Jason, as always, thank you for allowing us to have this space, to have these conversations and learn from each other. And again, a great big thanks to the Madison and Milwaukee panelists.
Absolutely. Thank you all for joining us today on our latest installment of the Madison Milwaukee Downtown Exchange. Pay attention to both emails from both groups. We're going to have 2 more sessions later on this year with great topics. Hope you have a wonderful day, and we'll see you downtown, hopefully with shopping bags or maybe some food in your hand to support downtown. Thank you and have a great summer. Talk to you soon.